The Dubai Health Authority and the Decide Diabetes programme, supported by its partners MPC, Merck, Serono and LifeScan, have signed an MOU to build awareness and educate the community on the risk factors that cause diabetes through the Dubai Risk Factor Awareness Campaign. The campaign looks to help the community to prevent and detect the condition at an early stage, as well as monitor undiagnosed cases. As a part of the campaign, a risk factor survey will also be distributed to all patients at the DHA's primary healthcare centres, while a special DHA-PHC medical team will follow up further diagnosis. DHA officials revealed that the UAE has so far taken positive steps towards diabetes and that the country has fallen from 2nd position to 10th globally. They added that early detection of type 2 diabetes is especially important, as it is preventative.
We know, all of us in the UAE, that the prevalence of diabetes in UAE is around 18.8% of our population. So there is must be many initiatives from the government, from DHA at the level of Dubai, how to tackle this issue. How can we prevent patients from a complication? How can we detect new cases, refer them to their physician? So this campaign is really very important also to together with some private company, share with them our impact, our diabetes, and to work together to fight against diabetes. The campaign will be run in all over the primary health care center. We have around 14 health centers. All patients from the age of 20, he had opportunity to get this screening program. And after that, by 7 months after we collect the data, we are targeting more than 500 patients coming to health center. After that, we will go outside the health center. We will go to the community, we will go to the malls, we will go to the government of Dubai, so many institutes in Dubai for screening more and more of diabetes.
Jan Felton, the CEO of the modern pharmaceutical company, went on to say that diabetes will be the biggest healthcare challenge facing the UAE in the coming 20 years, and that 30% of people who have diabetes remain undiagnosed.
The big issue with diabetes is not knowing what to do, it's getting patients to comply and behave in a way that will help them, and also to get people aware that they have diabetes. If you do those two things well, the medical system here can deal with and can cope with the diabetic diagnosis and can significantly improve lives. The problem is that there's very little focus on that because there are no products related to it. So the objective is to bring companies together in a community action to increase the awareness of diabetes and increase the compliance of patients with the treatment that's recommended for diabetes. I think all people are human, and I don't think this is particular to this region. I think quite often, and I speak personally for myself as a guy, you prefer to, I'll be fine, and you just get through it and you just sort of forget it or put it to one side. And with diabetes, that's a really dangerous thing to do. The earlier you detect it, if you can then change your lifestyle a little and lose a little weight and eat more reliably, it could well be that the diabetes will either disappear or that you will have no symptoms from the diabetes because you control it well.